Aortic stenosis is a condition where the aortic valve, located in your heart, narrows. This narrowing prevents the valve from opening fully, which obstructs blood flow from your heart to your body. The most common cause is the stiffening and hardening of the aortic valve due to calcium buildup and inflammation, often linked to atherosclerosis, hardening of the arteries. Let us understand aortic sclerosis and stenosis. Aortic sclerosis is an earlier, milder stage where the valve thickens but doesn't significantly obstruct blood flow. Aortic stenosis is the more severe stage where there's a significant obstruction. Causes of aortic stenosis in young patients, often due to a bicuspid aortic valve, meaning the valve has two flaps instead of three, in elderly, typically due to age-related degeneration and calcification. Hemodynamics in aortic stenosis. When the left ventricle, the main pumping chamber of the heart, contracts, the narrowed aortic valve creates resistance. This resistance leads to a pressure gradient, and it is called as mean transvalvular pressure gradient (MTPG) across the valve. The pressure in the left ventricle becomes much higher than the pressure in the aorta. This pressure gradient is a key indicator of the severity of aortic stenosis. Severe aortic stenosis is often defined by the 144T rule, MTPG, greater than 40 mm of mercury. Peak flow velocity, greater than 4 meters per second. Surface area of valve, less than 1 square centimeter. Normal is typically 3 to 4 square centimeters. To overcome the obstruction and maintain adequate blood flow to the body, the compensatory mechanism of the left ventricle works harder. This leads to concentric left ventricular hypertrophy, LVH. The muscular walls of the left ventricle thicken. And the overall mass of the ventricle increases. Leads to decreased cavity size. Mild to moderate aortic stenosis, often asymptomatic. Severe aortic stenosis patients typically become symptomatic, experiencing chest pain, shortness of breath, and fainting. Very severe aortic stenosis leads to heart failure and has a poor prognosis without intervention. Thanks for watching. Subscribe for more updates.